Renal pathology, consequences of renal failure. All right, so one of the hallmarks of renal failure is going to be azotemia. And all azotemia is, we already discussed, but it's just an increase in waste products within our blood because the kidneys can no longer clean the blood. Another hallmark of renal failure is going to be oliguria. We have a decrease in the ability to create urine, right? In order to kind of like clean the blood and create urine, we have to have a normal functioning kidney. And without that, we get decreased amount of production of urine. Now, there are a lot of consequences that we need to be aware of, but I'm going to be focusing in on solely a couple, okay? The first consequence I want to be aware of is uremia. So since we can't clean the blood, we have an increase in uremia, okay? Potential risk of uremia. And we know that uremia is a common cause of high anion gap metabolic acidosis. It's the U in mud piles. So that means that if a patient has renal failure, which has a risk of uremia, high risk of having uremia, then that means that patient also has a high risk of getting a high anion gap metabolic acidosis. So we have to be aware of that acid-base disturbance in patients with renal failure. Number two, very important, is EPO deficiency. Well, we know that erythropoietin is produced by the kidney. And so if we have a loss of kidney function, we have an overall decrease in erythropoietin. Hence, that leads to an inability for red blood cells to be created newly, okay? And that causes an anemia. And that anemia is going to be characterized by an increase in ferritin. So if you ever see a chronic kidney disease patient that has anemia and they give you ferritin levels are increased, start thinking mainly about renal dysfunction rather than a hem-onc disorder, okay? And then you can connect it to decreased EPO secondary to renal failure, okay? Very odd that a decreased EPO in chronic kidney disease causes anemia with increased ferritin, but it's something that you have to remember. And then another thing is renal osteodystrophy. So for renal osteodystrophy, essentially it's just bone pain. And the reason we have bone pain is because we have increased levels of phosphate. Okay, and the increased levels of phosphate in our body is due to the renal insufficiency, renal failure, because PTH is activated and it's trying to trash phosphate. It's trying to block its reabsorption at the PCT. But since the kidney is abnormal and it's failing, PTH can no longer work there. So we have high levels of phosphate in our bodies. And that binds to calcium. Okay, that binds to calcium within our body. So then we get an overall decrease in calcium over our body. Okay, and then what happens, since we have an overall decrease in calcium in our body because it's being bound to the high levels of phosphate, PTH is going to go even more insane, even more nuts. It's going to be released in such high levels. So even though it's not working at the kidneys, it can work at the bone. And so it causes severe reabsorption at the bone levels just to maintain calcium levels in the blood. And that leads to severe bone pain and essentially just like kind of destroys the bone. Okay, so just overall, that's what you have to know. It causes subperiosteal thinning of the bone, and it's due to the fact that we have an increase in osteoclasts and osteoblasts because of our PTH activation. All right. Now, lastly, as I said, you have increased phosphate levels within renal failure, and that makes sense, right? Because we don't have the ability now to essentially stop phosphate from being reabsorbed because PTH can no longer work at the kidney because the kidney is failing. But in early stages of kidney failure, we have normal phosphate levels. And that's due to the fact that our body has this growth factor known as fibroblast growth factor 23, FGF23. And increased levels of FGF23 essentially promote renal excretion of phosphate just to be protective in our body. Okay, so increased phosphatemia leads to an increase in FGF23 in early stages of renal failure, which can lead to an increase in secretion of phosphate earlier on in the renal failure process, kind of taking place of PTH. Okay, now, lastly, I just want to kind of emphasize what uremia is because I realized I didn't really discuss it. Uremia is just a syndrome that results from high serum contents of urea. Okay, and urea is toxic to the body, and so urea can then go and cause other issues, and the other issues are pericarditis. Can cause encephalopathy, which we'll see in the GI section, why encephalopathy occurs. But encephalopathy is very high yield, and the symptom that's associated with it is esterixis, which is just the flapping of the hands that's uncontrolled. And then you can see anorexia and nausea. All right? But that's pretty much all you have to know about consequences of renal failure. If you have any questions, please let me know.